All right, then I'll kick us off. So just apology in advance for my setup. My camera's up here and my computer's down there. So if I'm looking down, it's because I'm looking for humans in small boxes, and you're probably down here. So welcome to the American Spinal Injury Association Early Career Webinar Series, Season 1, Episode 5, on Knowledge Translation. Today is Friday, July 8th, 2022. So the American Spinal Injury Association's Early Career Clinician and/or Researcher webinar series is a bench-to-bedside view of the landscape of spinal cord injury research and medicine through the eyes of early career professionals. A little about the series. This multi-part series features episodes focusing on a single topic relevant to SCI research and medicine. In each episode, a dyad of presenters will grant us a parallax perspective on their SCI topic of expertise, ideally one perspective being more laboratory focused and one being more clinically focused. Each presentation will be about 20 minutes, followed by a 10-minute Q&A. Beyond sharing the emerging work of these young professionals in the SCI space, we have two further missions: to identify and archive the rising stars in this space, and to create a community for networking together these people based on a common mission. So thank you so much. My name is David McMillan, and Annie Palermo will introduce our first speaker.
Hello, everybody, and thank you again for joining us. First, we have Dr. Mandy Rounds, who is a research fellow at MedStar Health, and she's the current director of knowledge translation for the National Capital Spinal Cord Injury Model System. Her research interest is using patient-centered technology and approaches to increase quality of life in those with spinal cord injury and disease or disability. So, Mandy, I will stop sharing and you can take it away.
Great, thanks. Okay, I am sharing right now. Okay.
Looks good.
There we go. Okay. So thank you for having me today. I'm going to present on a patient-centered approach to knowledge translation. So I go ahead and put my email here because I would love to hear any feedback about any of the things that I bring up today. And just thanks for being here. So they wanted us to present a little bit on kind of our career trajectory thus far since we are early career. So I got my Ph.D. from George Mason University in Fairfax, Virginia. We still to this day talk about the one time we made it to the Final Four because our teams are not very good at sports. And that was like in 2006, I think. And then during my last couple of years of my PhD program, I started actually working with Dr. Grove's spinal cord injury research team at MedStar National Rehabilitation Hospital. I first started as a clinical research coordinator, and then I started to shift more into being more research focused, starting to write my own grants with Dr. Grove, and now I'm a research fellow there. The beautiful thing about being with MedStar is we actually do have an academic affiliation with Georgetown as well. So that's just a little of how I got to where I am today. The first knowledge translation thing I'm going to talk about that our team has started doing, and we started doing this with our Rehabilitation Research Training Center grant, and that is creating podcasts. So when we first started creating it, it was really scary and we all didn't know how to do it, but it has actually been such a rewarding experience because we are taking clinicians, researchers, and consumers when we're making these podcasts. So currently we have about 30 episodes in English and Spanish. Since our team does focus on the bladder and urinary symptoms, that's mostly what this podcast is about, but the more that we talk to consumers, the more they wanted to talk about other things. So we have another podcast that branches off from this called Beyond the Bladder, where we have episodes talking about sex after paralysis, relationships, exercise, and more. And then we also have some journal club articles because a lot of times patients, consumers don't have access to our articles. So we wanted a way to kind of have articles, talk about them, but also take the scientific rigor away from it a little bit and put it in a way that consumers could understand what these articles are that we're publishing. So there's a QR link to be able to access it. They're all free. They're all on all the major podcast platforms. And what's been really cool is to see how far we've reached with this podcast. So we've actually made it to 69 countries, and you can see on the map how many downloads and where those have been thus far. But it's been a really awesome, fun experience to be able to work with others in the spinal cord injury world and with consumers to share their experiences throughout. Next, I'm going to dive a little bit deeper into one of the knowledge translation applications that we're coming up with. So this is in the developmental phase. So like I said, feel free to shoot me an email of any other ideas that you might think of when you see this app, because we really want it to be a consumer-friendly app that's rooted in the science that we've been doing for a really long time. So it's called the Bladder Check App. I wanted to start with a quote from one of the participants that I have known for many years. And she called me up and she just said, I can't deal with my spinal cord injury, but I can't deal with my bladder. And I thought that was really strong in showing like, okay, the kind of research we're doing is extremely important in our spinal cord injury population. And she's someone that knows a lot about her spinal cord injury. She's 50 years old. She's been injured for 30 years. She has a complete spinal cord injury. So for her to say something like that was pretty impactful. So now I want to talk about, why we're even creating an app. So something that we constantly are hearing from patients is they want a way to manage their symptoms. So some of you might know this person, Dr. Stampis, and he's on the call right now as well. So he's going to be my patient, and he wants to maintain a healthy, happy bladder. Does he get checked for a UTI? Does he just monitor his symptoms that he's experiencing? Or does he self-manage his symptoms, like increase his water intake, do cranberry, all the other million methods that people have tried that are desperate to maintain this healthy bladder? So for those of you that are not super familiar with urinary tract infections, they cause 100,000 hospitalizations per year. One patient even said, I thought this UTI was going to make me meet my maker this time. So I know since we're talking to other spinal cord injury people, this is from a 28-year-old male. A lot of people are totally shocked that men even have UTIs, but yes, this guy gets them all the time. They cause 1 million ER visits, and they can even cause death if they go septic from a UTI. Another quote is, I wish they would have believed us in the ER that it was a UTI before he died from it. So our spinal cord injury population not only struggle with UTIs, but a lot of times people can't pick up on what they are when they go into the ER because of all the other complications they're having as well. And they cost $1.6 billion. So that's where getting this app out there is really, really important to provide guidance for these patients so they know when to act, when to self-manage, and when to go to the doctor. And we're calling it the Bladder Check App for now, to maintain a healthy bladder. So what is the science behind this? So I'm not just throwing an app out there of like, hey, use this. We, for multiple years now, have been developing urinary symptom questionnaires for neurogenic bladder. There's 3 different components that go into a UTI diagnosis, typically urinalysis and culture, and the patient depiction of their symptoms of what's going on. All of those things were looked at, but the one thing that a patient can actually tell us about is their symptoms. And from the very beginning of our research, we figured out, okay, based off their bladder management, meaning if they use an intermittent catheter, an indwelling catheter, or they don't use any catheter at all, there are distinct differences on the types of symptoms that they experience. So after many years of doing a patient-centered, patient-reported outcome approach that I'm going to talk about next, we came up with these 3 instruments. It's a lot of symptoms. For those that void, there's 29 symptoms that they experience. For those that use an indwelling catheter, there's 24 symptoms that they commonly experience. And for those with intermittent catheters, there's 31 symptoms they commonly experience. So these Paper forms are actually available, so I did put a QR code at the top if you would like to use them in your own practice or give them to your patients as well. So how did we develop these urinary symptom questionnaires for neurogenic bladder? I always say it was a very, very long process. First, we took focus groups and we created a guided script to ask about their common urinary symptoms that they experience. Typically, you'll see a lot of times in research, they only ask clinicians. We actually asked patients as well. That's what made it patient-centered. Then we took their perspective and the physician's perspective separate of one another, and we combined all of these symptoms to come up with a common list. We did this for each of the urinary symptom questionnaires. So we have one for voider, intermittent, and indwelling. We did this process 3 separate times of doing interviews, combining them, seeing what that output became. So what does that look like for a self-management app? There's a ton of symptoms for them to go through. And as you'll see next, there's a ton of prompts that come from it, but it's all on paper right now. So with the app, all they're going to answer is, do they empty their bladder using a urinary catheter? If they do, if they don't, they'll have the voiding symptoms show up. If they do use a catheter, we're going to ask what type of catheter. And based off of the type of catheter, those appropriate symptoms are going to pop up for them. So these particular types of symptoms that they're going to see, first, there's an actionable category. So these are kind of like your pretty bad ones, like they're having autonomic dysreflexia, they're feverish. And the prompt that would come from this is if they have one or more of these symptoms, we tell them to seek medical attention for their symptoms. Not necessarily indicative of a UTI, but these symptoms are pretty bad and they need to get them checked out. Next, we have a bladder category. For this, it's blood in urine, blood clots in urine, sensation of urinary urgency, urine leakage. And for these, we say if you have one or more bladder and you have actionable symptoms, now we're talking about a possible UTI. Or if you have 4 or more of these bladder symptoms, so all the bladder symptoms, you might want to get checked out for bladder function. Or if you have 1 to 3 and no other symptoms, you might want to just self-manage and monitor your symptoms. So as you can see, it gets very, very complicated when it's just in the checklist form. So that is what came about for this Bladder Check app of like, okay, let's just give them something that they can click and these prompts pop up for them. There's no human error involved. They don't have to worry about, okay, if there's 1, if there's 4, so on. And then there's the urine quality category. So dark urine, cloudy urine, bad smelling. If they have 1 or more and no other symptoms, we tell them to just self-manage in whatever way they typically manage. And then we have a constitutional or kind of like an other category. It is 1 or more and no other symptoms. They just need to monitor their symptoms, make sure they don't get any worse. And they might want to consider seeking medical assessment if these symptoms are pretty bad. So this is the second sheet that comes on that checklist. So once again, you can see it is a nice flow chart that we've set up, but it can get complicated very quickly. So what this checklist and flow chart looks like on the app is they're going to collect these, they're going to click the symptoms that they're experiencing, and then they're going to have one of these 5 prompts come up. So consider seeking medical attention for UTI, consider seeking medical attention, consider seeking medical attention for bladder function, just self-manage, or just monitor your symptoms. So it simplifies it for the patient that is using this app, that they just click the symptoms that they're experiencing and they have one of these prompts that come up. The beautiful thing is we've also been funded by the PVA to add other things that might be helpful for someone that is having a lot of UTIs, and they might self-manage in a multitude of different ways. So I just talked about symptoms, but we're also going to incorporate features like voiding cycles, how many times they cath, maybe medications or bladder washes that they might use, and a urinary tract infection log. This will all allow them to, all these features can also be exported so they can send it to their physician or they can just monitor it. And then I just wanted to end on this note. So I know all of us have probably heard this quote before of listen to your patient, he is telling you the diagnosis. when you're coming up with all of these KT activities or dissemination products, listen to the patient or your participants because they are telling you what they want and what they need. Thank you. Okay.
And you can stop screen share now, Mandy.
There we go. Perfect.
Okay, we can invite any questions from the audience right now. You can either hand raise or just chime in by unmuting. Okay, I have a question to start us off. Mandy, can you talk a little bit about the team who was involved with the development of the app? Because I imagine some of these things exceed our maybe like digital technological expertise.
Yeah, so the team is actually not as big as you would think right now. We are in the process of designing currently. So I actually do have some design skills that are used in, it's called software called Figma. So things that you might take forever to do in PowerPoint, you can actually do in Figma, and you can also do prototyping and sharing it, the process of using the app to consumers. So that is the plan right now. It's in the design phase. I'm designing it with another research scientist that is at MedStar who is well equipped in that field. So I wanted to learn that skill, so I'm doing it with him. But then once we are done with the designing phase in Figma, all I do is I literally give it to a developer, and he is the one that writes all the code. It's going to be a web-based app, so it's actually going to be in the cloud instead of a standalone app, which has a lot of good features that I found out about in this process compared to a standalone app.
I also, can I ask a question too? How were you able to get consumers involved? Because sometimes that can be a real struggle. So what were the kind of, how did you do that?
Yeah. So all of our grants now, all of our grant proposals have some kind of advocacy groups involved, consumer experts involved. So I am a huge advocate that any type of research needs to have consumers involved. And first, if you want consumers involved, you need to pay them in some way. So that is the first thing. If you want them to be involved, you probably need to pay them. So we incorporate them in our research for every project. So we've always had like 2 or 3 consumer experts written into the grant, but then also we have a relationship with advocacy groups like United Spinal, Spina Bifida, MS Society, and then dependent on that consumer group, they each have different requirements, honestly, and what they want to participate in or how they share. And yeah, so get them involved while you're writing the grant is my biggest takeaway from that question.
Femke, you can step in.
Yep.
First of all, thank you for the great talk. That was very interesting, and I totally agree with your last point about engaging people with lived experience. But my question is more about, you did lots of steps to design this app, interviews, and I was wondering if you can elaborate a little bit about how you decided to do what. Did you use a certain framework that exists to guide you for like developing this app, or like how did you know what to do?
Yeah, that's a great question. So the app was never a part of the picture in the beginning. So what was a part of, we had 3 separate grants for each of these different instruments that we were creating. So first we had the intermittent cath one that was funded by PCORI. Then we had a FUR grant, and then we had a Nielsen grant. And literally each of those grants supported one instrument. Then as we were creating these instruments with the patient-centered approach and everything, I'm like, these are great and all, but these can't stay on paper. So what came about was discussion of, okay, how do we make this available in an easy way to consumers? And that's when the idea of this app came in. So the framework really was rooted in making these questionnaires, and then now, okay, we're making these questionnaires electronic and user-friendly now.
Thank you.
Yep.
And I kind of have a follow-up question for that, if that's okay.
Yeah.
So is there, like you kind of talked about this framework, but it seemed a little bit specific to kind of your experience. What would you give, what kind of guidance would you give to people looking to translate this to other areas? Like I work in respiratory function, and I see something like this being really, really important. You know, what's your guidance to translate it to a different area?
Yeah. So look at the guidelines that are out there for your particular, niche, right? So if there is respiratory guidelines in some way, you need to look at that first. What is the science behind that? What is it that patients or consumers could actually learn from the guidelines, or how can they apply these guidelines in some way? And then possibly you can translate it into something user-friendly, right? So whether that's, you see fact sheets all the time, right?
Mm-hmm.
Or, other type of applications, but, an app may not be suitable for a respiratory thing. Or you might want to focus on respiratory training, but you need to look at the guidelines that have already been set for that respiratory training protocol, right?
Cool. Thank you.
Sorry, did I answer your question?
No. That's,
Okay.
Starting with what's out there.
Yes.
Yep.
Just like everything else, right?
Yeah.
But if there's no, and when it comes to like urinary symptoms and UTIs, the guidelines were out there, but they're not working. So we know that, and that's why we, came up with urinary symptom questionnaires to begin with, because there is no gold standard for a UTI currently.
Correct. Yep. And that's fairly similar to respiratory as well.
Yeah.
So thank you. Thank you so much.
This is great. Having a little bit of time though. Okay, so is there anything else, Mandy said? This is on paper, it needs to go digital.
Yeah.
And then Annie asks about translating this to other outcomes. So in the context of this being an Asia webinar, there's something always when it comes to Asia that I'm coming across every day that is on paper or just in our memories, and that I wish would be on an app, both for us and for the people with spinal cord injuries. So to all of those here, all of those listening, please let's develop an INSCI app. Please, a level, grade, motor and sensory scores. Please, can we put this on an app so that people don't have to try and report incorrectly, which we know they do. So I'm just going to take this to make that call.
Easier said than done. Most health apps are about $250,000 to develop. So, yeah.
There you go. All right.
That's why it probably hasn't been developed yet.
Hopefully the board is listening. Okay, great. Unless there's anyone in the audience who has another question. All right, thanks so much, Mandy. And Annie, if you can go ahead and introduce Femke.
All right, I'll be introducing our next speaker. So next we have Dr. Femke Hoekstra. She is a postdoctoral research fellow in the Spinal Cord Injury Action Lab, Spinal Cord Injury Action Canada Lab, and Applied Behavior Change Lab at the University of British Columbia. Her research focuses on understanding and improving knowledge translation processes, especially in the area of rehabilitation and health promotion. So you can take it away. Thank you.
Thank you for this introduction. Can you all see my slides?
Looks good.
Okay, perfect. So today I want to talk to you about bridging the gap between spinal cord injury research and practice. Before I start, I would like to begin by acknowledging that I'm presenting today at unceded territory of the Silks Okanagan people. And for this talk, I will start with a little bit to tell you a little bit more about my KT or knowledge translation career path so far. So I'm from the Netherlands, did my bachelor's and master's at the VU University in Amsterdam, Human Movement Sciences. And during my master's, I had the opportunity to study the effect of robot-assisted gait training in people with spinal cord injury. And so I trained people with SCI on this like a local mat and looked at fitness levels in particular. And this internship really gave me opportunity to get clinical experience with working with people with SCI in a rehab center. So after my master's, I moved on to my PhD in the north part of the Netherlands, University of Groningen. And I did my PhD on rehabilitation, sport and active lifestyle. And I studied on a nationwide level the implementation of a physical activity promotion program that we implemented in 18 different rehabilitation centers and hospitals across the Netherlands. And my PhD project really gave me insights into how implementation processes work on a system, organization, and professional level. And then right after my defense, I crossed the ocean and moved to Canada, where I started my postdoc here in Kelowna at the University of British Columbia in the SCI Action Canada Lab and Applied Behavior Change Lab, which are run by Dr. Kathleen Martin-Guinness and Heather Gainforth. And since the start of my postdoc, I have been working on like lots of different projects, did lots of work on studying research partnerships, how to work together in a partnership with researchers and research users. I will tell you more about that in a bit. I involved in studying a KT focus network as the CDPP, which stands for Canadian Disability Participation Projects, which is a big network of researchers and community partners working together to enhance participation in people with disabilities. Did some translation, KT work on the physical activity guidelines for adults with spinal cord injury. And one of my other research interests is focusing on physical activity counseling in people with SCI, and also study that on a client level, how it's been delivered and received. And in particular within our currently EPIC SCI pragmatic trial. So lots of different projects, different things, but they have one thing in common, and that is that they all have been conducted in partnership with relevant research users, either people with lived experience, clinicians, organizations, policymakers, etc. And I believe that the key to successful implementation and dissemination is to do your research in partnership and meaningfully engage your end users as partners, and not just as participants only. So that is where I want to talk to you today about. What will you learn, hopefully, in the next 10 minutes or so? That is, I hope that at the end of this presentation, you at least know what the IKT guiding principles are and how they could be used to improve knowledge translation of SCI research findings. So first of all, why are we actually doing a webinar like this on knowledge translation? What is really the problem? Well, from a research perspective, as researchers, we have been trained to write grants, get money, do your research, and publish your results. And then do it all over again. Write your grants, get money, do your research, and publish our results. And the problem here is that we are stuck on repetition. And more importantly, the end goal here is publishing the results and not applying that. And because of that, we are sacrificing real world impact. And as a result, many research findings, including SCI research, are not or very slow translated to real world settings and practices. And the 70 to 20 a year gap between discovery and implementation is, of course, unacceptable, because we are wasting all these resources and time devoted to do the research, and interventions and resources, they become inaccessible for the general population. But the good thing is that doing research in partnership with your relevant end users is a promising approach to bridge this gap between research and practice. And an example of a type of research partnership is integrated knowledge translation, or IKT. And IKT is a type of research partnership that is unique in the way that it's focused specifically on the application of the research findings. And within the SCI research community, we can define IKT as the meaningful engagement of the right research user at the right time throughout the SCI research process. So from planning to conduct to dissemination to application. So what are some of the benefits of using such an IKT or research partnership approach? Well, to answer that question, we did a big review of reviews on principles, strategies, outcomes, and impacts of different types of research partnerships across different areas. And what we found is that we identified 82 different outcomes or impacts that were related to the research involved, the stakeholder, the relationship between the community or society, and the research process. And important here to mention is that 2/3 of the outcomes and impacts that we identified were classified as beneficial. So some examples of the most frequently reported outcomes and impacts were that research partnerships created more relevant and useful research findings, stakeholders felt empowered and gained knowledge and skills. It created recruitment capacity, and it generated credible and valid data. So if you want to learn more about research partnership and co-production in healthcare, I would highly recommend this new book edited by Ian Graham and colleagues that just came out. And so basically, if we summarize the findings in there, it's like that so far in the literature, we know there are many benefits of research partnership, but specific strategies or mechanisms on how to achieve them are not clear yet. And so there is a need for improvement in guidance to ensure we meaningfully engage our research users in the research process, and also to avoid a tokenistic process in these engagements, in the engagement of our end users. So to make a first step in the improvement of the support for meaningful engagement of research users in the SCI research, a strong partnership led by Dr. Heather Gainforth worked together to co-develop the IKT guiding principles for conducting and disseminating SCI research in partnership. And what I would like to mention here is that this team included representatives of all the 3 key roles in the SCI research system, which are the researchers, research users, and funders. And this is just an overview of organizations that were representative in the development process. So how did we actually came up with these principles? Well, it was a long process. It took us over 2 years to develop them, and we didn't just came up with them. We used a systematic and rigorous approach, and the principles were informed by 4 data sources: the big review of reviews that I just talked to you about. Then we did a scoping review in SCI specific research partnerships. We did interviews with IKT champions in SCI research. And then we did a Delphi study. And following those 4 projects, we organized a 2-day in-person meeting. This was all before COVID, with the whole panel to actually develop the principles. And this meeting was structured with following using the agreed to framework to ensure a rigorous and transparent process. So what are the principles? Well, there are 8 of them, and we define them as the fundamental norms and rules or beliefs that represent what is desirable or positive for a person, group, organization, or community. We always say that the principles are the head and the heart that guide a research partnership. So I'm now going to present all 8 to you and walk you through them. So to engage more meaningfully in research that is relevant, useful, and reusable, the IKT guiding principles are: 1, partners develop and maintain relationships based on trust, respect, dignity, and transparency. So this first principle really highlights the relational aspect of doing research in partnership. 2, partners share decision making. So this means that it's not just one person on the partnership that gets to make all the decisions. No, everyone has the decision making power. And this also is like, so it's not just a checkbox that you need to take off because the grant application wants you to do the research in partnership. 3, partner foster open, honest, and responsive communication. Well, we all know how important communication is. 4, partners recognize, value, and share their diverse expertise and knowledge. And what this means is that, like, not all knowledge need to come from like someone with a PhD. It can come from lived experience and valuing that knowledge. So everyone in the panel, in the team, can bring something different to the table. And that is what can make a partnership strong. So 5, partners are flexible and receptive in tailoring the research approach to match the aims and context of the projects. So that also means that you need to know and understand what everyone's needs are and be flexible in understanding that. So 6, partners can meaningfully benefit by participating in the partnership. And 7, partners address ethical considerations. And 8, partners respect the practical considerations and financial constraints of all partners. So we have a website, iktprinciples.com, and where you can learn more about the IKT principles. We also have a one-pager postcard that you can download, where is explained what the principles are, why they are developed, and a list with a glossary with like terms and definitions that we think are important to understand. So I highly recommend to have a look at our website and just like learn more about it if you're interested. So then what's next for us? So we finished the first step of the project, and that was to develop and publish the principles. And now we are in the middle of the action phase, in which we are developing tools and resources that will help people to use the principles. So while we are waiting for all these tools or resources that will come out soon, I wanted to give you some initial guidance on how you could use these principles if you want to start today. So to get started, I always encourage everyone to discuss the principles with the people that you want to work with, and ask them, what does meaningful engagement look like to you? How do you want to be involved? And then you can bring up these principles and ask the question, what does it look like to you to follow these principles? Because there's not one right way to do it. It depends, every project is different, every partnership is different. But have that conversation and talk with your partners about that. And then second, you could also use principles to set clear boundaries about what is okay and what is not okay. And then three, you should think about a process to hold yourself and your partners accountable for supporting meaningful engagement. And then finally, and I cannot emphasize that enough, that it is how important it is to also reflect on your partnership processes and report on it. So report on what you did, how you did it, and as well what the outcomes were, because when you report on it and reflect, we can all learn from each other and we can all improve ourselves. And that brings me to my last slide about the take-home messages. So basically, the two things that I hope you take away from this talk is that research partnership approaches in which researchers and research users work together on a research project can enhance knowledge translation of SCI research findings. The IKT guiding principles may help to engage more meaningfully in research that is relevant, useful, and usable. And with that, I wanted to thank you all for your attention and happy to take any questions. And I will stop sharing my screen.
Thanks so much, Femke. If I can open up here with the question as a user of your principles, and thank you so much. On your third to last slide, you show step 4, which is to report, evaluate and report. And I haven't found a good way for me to know if what I'm doing is the thing I'm supposed to be doing. I might just be feeling around in the dark. So is there a way for me to assess my attempt to implement these awesome principles?
Well, I think you are already far ahead with a lot of people by at least thinking about it. So I think that is there's what I said, there's not one right way to use these principles. But having that conversation, I think, is super important. And in these conversations, not at the start, but throughout, and reflect with yourself, with your partners, what went well, what could we done better. And then what I mean with reports, I would love to see that in a paper. I would love to see in your appendix, if you have the one sentence in your paper, we use the IKT guiding principles to guide our IKT approach in this study, and look at an appendix with all the things that you did to engage your end users meaningfully throughout. And what that could look like, we reported on it in different ways. We also haven't found the perfect way to do it, because we are also figuring out what it is that we want to report. But the strategies, what are the observable actions that you did, the meetings that you had with your partners, what was the objective during the meeting? How did it change your research? Maybe because that one meeting with your end users changed the whole focus of your project. All these things we would like to see in a table. In I don't know, that these are the things that that we were looking for, and that could help everyone to move forward and to also help provide ideas, I think, for others to engage research users in your research.
No, thank you so much. As a follow-up to that, me being someone there doing that process and the other people who are there doing the process, I think from a perspectival and a procedural perspective, it becomes clear to us whether or not it's successful, but then it's hard to communicate that to people who weren't there. So I hate saying this, but if there was like some quantifiable metric that could come out of it so I could tell other people if this is working, this is just more of a suggestion now at this point. So
Yeah,
thanks.
we are working on creating an evaluation tool, but we are not there yet. Because it's not like an easy, it requires a little bit of time to figure out what exactly is that we need to, when is it successful? What does that mean? And how do you measure that? Yeah, it's so relational, right? So yeah, but we are working on it. Elena is one of our PhDs. This is one part of her PhD project to develop a tool that will help us to evaluate the principles.
I have a question next, if that's okay.
Yeah, sure.
When you were talking about how you went about developing and the people that were involved, you mentioned funders, researchers, and consumers. Did you also have clinicians involved as well?
Yeah, so I said research users, and with research users, we mean that everyone who could benefit from the research.
Understood.
So that is clinicians, like people with lived
Yes.
experience, organizations. Yeah.
Understood. Okay, thank you for clearing that up. And then as a follow-up, you talked about the Agree to conference that could you talk a little bit about, could you explain that a little bit more?
Yeah, so the Agree to instrument, it's an instrument, and I don't know from the top of my head like where the Agree stands for anymore, but it's an instrument that is developed to create clinical guidelines.
Okay.
And it's just like a step-by-step process, and then they have like agreed to items, all the things that you need to do. So you need to like look into the literature, you need to know what the evidence is, you need to bring a group of like stakeholders together, that you need to have a discussion about the literature, and like et cetera, but they have like a whole structured process of how clinical guidelines should be developed, and that's what the Agree to instrument is. And we basically adapted that instrument to use it to develop the IKT guiding principles. And we did something similar for translating the physical activity guidelines from like translating the scientific exercise guidelines to community physical activity guidelines for adults with SCI.
Okay, thank you.
I put the acronym in the chat. Appraisal of Guidelines for Research and Evaluation Instrument.
Thank you.
Absolutely. Unless anyone has any further questions, I have one possibly final question about some of the limitations, which I try and think a lot about when it comes to research partnerships, because from my experience, it's like all good, and I'm very skeptical of something that seems all good. So recently, I've been listening to this work of a researcher, C.T. Nguyen. He's a professor of philosophy. He talks about this essential tension between expertise and surveillance, and draws forth this potential downside here. Expertise can be undermined when experts are required to limit their actions to only those actions that can be justifiable to non-experts. And so is there something about having experts try and do things with non-experts that is going to possibly hinder this whole process?
How do you define experts?
I think academically, we tend to do so in terms of intellectual, propositional type of epistemics. I think you've already identified my loophole through this problem, but
it's like the one principle about valuing different type of knowledge and expertise. Like what I said, like knowledge doesn't need to come from someone with a PhD or with a research career. Knowledge can come from someone with lived experience. So I wouldn't say there is like non-experts.
the researchers, at least I feel like I'm usually a non-expert in the lived experience component, right? So
Exactly.
I do think that
everyone is an expert in their own way.
yeah, absolutely. All right, you beat me there. Okay. Unless there's any last questions. Okay, we can thank both of our presenters. Thank you so much, Mandy and Femke. And we will outro now with our simple statement. Asia's Early Career Webinar Series was founded, produced, and is hosted by myself, David W. McMillan, Anne E. Palermo, and Raul Socheva of Asia's Early Career Committee. And importantly, right now, we are looking for help with a volunteer production assistant. So hello, Internet and Team Spinal Cord Injury. If you're interested in helping us with this and possibly also Asia's podcast called SCI Perspectives, please reach out via email. You can email the front office, anyone.
And we are also looking for more people to apply for, to share their research or clinical expertise or the work that you're doing right now. So please, please, please go to the Asia website and feel free to apply, or you can nominate, if you don't think you are an early career professional, then you can feel free to nominate somebody who you know that is, and they can share their work.